Nclex priority and delegation can make or break your exam score. In this video, we're tackling 20 high-yield questions designed to sharpen your clinical judgment, test your prioritization skills, and help you choose the most critical action every time.
Question 1. A nurse is caring for 4 clients on a medical surgical unit. Which client should the nurse assess first? A. A client with chronic heart failure who has 2+ pitting edema and reports shortness of breath when climbing stairs. B. A client with pneumonia receiving IV antibiotics who has a temperature of 101.2 degrees Fahrenheit, 38.4 degrees Celsius. C. A client post-thyroidectomy reporting numbness and tingling around the mouth and in the fingertips. D. A client with diabetes mellitus who has a blood glucose of 250 milligrams per deciliter and is requesting breakfast. The correct answer is C. A client post-thyroidectomy reporting numbness and tingling around the mouth and in the fingertips. Rationale: numbness and tingling around the mouth and fingertips following thyroidectomy indicate hypocalcemia from accidental parathyroid gland removal or damage during surgery. This can rapidly progress to tetany, laryngospasm, and airway obstruction, a life-threatening emergency requiring immediate calcium gluconate administration. This is an acute, unstable situation requiring immediate intervention. Option A describes chronic heart failure with expected findings and exertional dyspnea, stable chronic condition. Option B shows expected findings for pneumonia. Fever is anticipated, and the client is already receiving appropriate treatment. Option D, while elevated glucose needs addressing, is not immediately life-threatening and can be managed after the airway-threatened client. Remember, post-thyroidectomy patients need close monitoring for hypocalcemia. Check Schwastek and Trousseau's signs, and bleeding or hematoma formation. Clinique RN test day tip. Priority means ABCs plus acute unstable over chronic stable. Use the framework, will they die in the next 5 minutes? Post-thyroidectomy hypocalcemia can cause. That's your #1 priority. Pattern recognition. Tingling or numbness following thyroid surgery is a sign of hypocalcemia, which carries a high risk for airway compromise and requires the nurse to assess that patient first. Nclex loves this scenario because students miss the connection between parathyroid damage and calcium levels.
Question 2. The nurse receives the morning report on 4 postoperative clients. Could you let me know which client needs the nurse's immediate attention? A. A client 2 days post-appendectomy with a temperature of 100.8 degrees Fahrenheit, 38.2 degrees Celsius, and incisional pain rated 6 out of 10. B. A client 8 hours post-hip replacement with 50 milliliters of bright red drainage in the surgical drain. C. A client 12 hours post-cesarean section reporting sudden severe chest pain and shortness of breath. D. A client 1 day post-colectomy with hypoactive bowel sounds and no flatus. The correct answer is C. A client 12 hours post-cesarean section is reporting sudden severe chest pain and shortness of breath. Rationale: sudden severe chest pain and shortness of breath in a post-operative client, especially post-cesarean section, suggest pulmonary embolism, PE, a life-threatening complication. Pregnancy and surgery are both risk factors for venous thromboembolism. This requires immediate assessment. Oxygen saturation, vital signs, oxygen administration, and provider notification for possible anticoagulation and imaging. This is a true emergency. Option A shows expected postoperative findings. Low-grade fever is common in the first 48 hours post-surgery due to atelectasis, lung collapse from shallow breathing, and the pain level is manageable. Option B describes the expected drainage amount and color in the immediate post-op period for a hip replacement with surgical drain. Option D shows expected findings. Bowel sounds don't return immediately after abdominal surgery, and the absence of flatus is normal in the first 24 to 48 hours.
Clinique RN test day tip.
Sudden plus severe plus chest pain plus SOB in post-op equals PE until proven otherwise. This is a classic Nclex pattern you must recognize. Remember the mnemonic for PE risk factors: thrombosis, trauma, surgery, hormones, pregnancy, OCP, rest/immobility, obesity, malignancy, blood disorders, old age, smoking, immobility, surgery. Post-cesarean has multiple risk factors: surgery plus pregnancy plus immobility. Key words that scream emergency are sudden and severe. These words indicate acute deterioration requiring immediate action. Students often pick option A because fever and pain are expected, but you must distinguish between expected low-grade post-op fever, atelectasis, versus high fever with other sepsis signs. Pattern: fever less than 101 degrees Fahrenheit in the first 48 hours post-op without other symptoms is usually atelectasis, not infection. Teach clients to cough, deep breathe, and use an incentive spirometer. Also know post-op day 3 to 5 is the highest risk for PE, but can occur anytime post-surgery.
Question 3. A nurse on a medical unit has received a report on 4 clients. Which client should be assessed first? A. A client with heart failure taking digoxin who reports seeing yellow halos around lights. B. A client with COPD who has an oxygen saturation of 88% on room air. C. A client with type 1 diabetes with a blood glucose of 68 milligrams per deciliter who is alert and requesting orange juice. D. A client with chronic kidney disease who has a potassium level of 5.8 milliequivalents per liter and reports muscle twitching. The correct answer is A. A client with heart failure taking digoxin who reports seeing yellow halos around lights. Rationale: yellow or green halos around lights are a classic sign of digoxin toxicity, which can lead to life-threatening cardiac arrhythmias, heart blocks, ventricular tachycardia. Digoxin has a narrow therapeutic range, and toxicity can cause visual disturbances, nausea, confusion, and dangerous dysrhythmias. This requires immediate assessment, holding the next dose, checking the digoxin level and potassium. Hypokalemia increases toxicity risk, obtaining an ECG, and notifying the provider. This is potentially immediately life-threatening. Option B shows expected findings for COPD. Patients with chronic COPD typically maintain lower oxygen saturations of 88 to 92% and are on the hypoxic drive, so 88% is their baseline. Option C, while hypoglycemic, the client is alert and able to treat themselves with oral glucose. This is not immediately life-threatening and can be quickly resolved. Option D shows mild hyperkalemia, normal 3.5 to 5.0 milliequivalents per liter, which needs monitoring and treatment but isn't as immediately dangerous as digoxin toxicity with potential for lethal arrhythmias. Clinique RN test day tip. Digoxin toxicity represents a critical Nclex gold concept that requires you to memorize its classic clinical signs: yellow-green vision, nausea, confusion, bradycardia, heart blocks. The mnemonic is DIG indicates disturbances in vision, irregular pulse, GI upset. When you see visual changes, halos, yellow-green tint, plus digoxin means stop the med and assess for toxicity immediately. Common trap in option B. Students panic seeing 88% oxygen, but you must know that COPD patients live at 88 to 92% oxygen. Giving them high-flow oxygen can actually remove their hypoxic drive and cause respiratory arrest. Never titrate COPD patients to 100% oxygen. Another key concept, hypoglycemia, option C, seems urgent, but if a patient remains alert and retains the ability to self-treat, they are generally not considered the highest priority over potential cardiac arrest from digoxin toxicity. Remember the principle: conscious hypoglycemia less than potential lethal arrhythmia. Also know, factors increasing digoxin toxicity risk include hypokalemia, renal failure, and elderly patients. Always check potassium before giving digoxin.
By the way, if you want to practice these same style questions, check out the Clinique RN Q-Bank. It's got everything you need to level up your prep. AI feedback system that explains every answer in plain English. Cat mode so you can train under real Nclex conditions. And a summary sheet to help you review and track your progress after every session. It's like having your own personal Nclex coach in your pocket. You can sign up for free using the Clinique RN link in the description and start practicing right after this video.
Question 4. A charge nurse is making assignments for 4 clients. Which client assignment is most appropriate for a newly licensed RN who has just completed orientation? A. A client with diabetic ketoacidosis receiving continuous insulin infusion via IV pump. B. A client admitted 2 hours ago with chest pain awaiting cardiac catheterization. C. A client 1 day post-operative with stable vital signs requiring routine wound care. D. A client with a new diagnosis of Guillain-Barré syndrome with ascending paralysis. The correct answer is C. A client 1 day post-operative with stable vital signs requiring routine wound care. Rationale: a stable post-operative client requiring routine wound care is the most appropriate assignment for a newly licensed RN. This client is stable, predictable, and requires fundamental nursing skills within the new nurse's scope of practice. Option A involves a complex, unstable client requiring critical care skills. Continuous insulin infusion requires frequent monitoring, titration, and management of a life-threatening condition, DKA. Option B is an unstable client with potential acute MI awaiting invasive procedure, requires experienced assessment skills and anticipation of rapid changes. Option D involves a client with a new neurological condition, ascending paralysis, that can rapidly compromise respiratory function, requires expert assessment and anticipation of potential intubation needs. Assignment principles: new, inexperienced nurses get stable, predictable clients. Experienced nurses get complex, unstable, or rapidly changing clients. Clinique RN test day tip: assignment questions equal stable versus unstable versus predictable versus unpredictable. Use this framework. New nurses are best suited for patients who are stable and predictable with routine care needs, while experienced nurses should be assigned complex, unstable cases at high risk for deterioration, such as a patient with Guillain-Barré whose ascending paralysis signals an imminent risk of respiratory failure. Nclex loves testing this. Make a mental list. Complex indicates new admissions, awaiting surgery or procedures, critical drips, neurological deterioration, hemodynamic instability. Question 5. The emergency department nurse is triaging 4 clients who arrived simultaneously. Which client should be seen first? A. A 6-year-old with a temperature of 103.5 degrees Fahrenheit or 39.7 degrees Celsius, petechial rash, and stiff neck. B.
a 45-year-old with a deep laceration to the forearm with controlled bleeding. C, a 70-year-old with a hip fracture reporting pain 8/10. D, a 28-year-old with a suspected ankle fracture, swelling, and inability to bear weight. The correct answer is A, a 6-year-old with a temperature of 103.5 degrees Fahrenheit or 39.7 degrees Celsius, petechial rash, and stiff neck. Rationale: the combination of high fever, petechial rash, and stiff neck in a child is classic for bacterial meningitis, likely meningococcal, which is a medical emergency requiring immediate intervention. This condition can rapidly progress to septic shock, disseminated intravascular coagulation, DIC, and death within hours. Immediate priorities include isolation, droplet precautions, blood cultures, lumbar puncture, and IV antibiotics within 30 minutes. This is emergent/life-threatening. Option B has controlled bleeding, urgent but not emergent since bleeding is controlled. Option C, while painful, is stable, and a hip fracture can wait for pain management after the life-threatening condition. Option D is also urgent but not emergent, can wait for X-ray and treatment after the potentially septic child. Triage categories: emergent/immediate life threat, greater than urgent, needs treatment soon, greater than non-urgent, can wait. Clinic RN Test Day Tip: to master triage, you must apply the framework of emergent versus urgent versus non-urgent, categorizing patients who are unconscious, unresponsive, actively bleeding, or experiencing severe trauma as emergent. This clinical pattern recognition is vital because a patient presenting with a fever, petechiae, and a stiff neck indicates meningitis, which is an emergent life threat. The petechial rash is a key indicator of potential meningococcemia, bacteria in the bloodstream causing small hemorrhages, which can be fatal within hours. While students are often distracted by high pain scores, such as an 8/10 for a hip fracture, it is a common rule that pain is not a priority over an immediate threat to life or potential sepsis. For bacterial meningitis, you must implement droplet precautions and ensure antibiotics are administered within 30 minutes of recognition, because time is equivalent to saved brain tissue.
Question 6. A medical surgical nurse is assigned 4 clients. After receiving the morning report, which client should the nurse see first? A, a client with ulcerative colitis having 8 to 10 bloody stools per day requesting pain medication. B, a client with cirrhosis who has a hemoglobin of 9.2 grams per deciliter and hematocrit of 28%. C, a client with pancreatitis reporting severe abdominal pain radiating to the back, rated 9 out of 10. D, a client with peritonitis who has absent bowel sounds and reports sudden relief of abdominal pain. Correct answer, D. A client with peritonitis who has absent bowel sounds and reports sudden relief of abdominal pain. Rationale: sudden relief of pain in a client with peritonitis is an ominous sign suggesting possible bowel rupture or perforation. When a diseased organ ruptures, the sudden release of pressure can temporarily relieve pain, the calm before the storm, but this leads to peritoneal contamination, sepsis, and potential septic shock. This requires immediate assessment and surgical intervention. This is a surgical emergency. Option A describes expected symptoms of ulcerative colitis exacerbation. Frequent bloody stools are characteristic, but not immediately life-threatening if managed appropriately. Option B shows anemia, which is expected in cirrhosis due to various factors: GI bleeding, bone marrow suppression, nutritional deficiencies, a chronic issue requiring monitoring but not immediate intervention. Option C describes expected severe pain with pancreatitis. Pancreatic inflammation causes intense pain radiating to the back, needs pain management, but is an anticipated finding, not an acute change indicating deterioration. Clinique RN Test Day Tip:
The sudden relief of pain in gastrointestinal emergencies indicates a rupture or perforation, which is considered the worst possible sign rather than an improvement. When severe pain stops abruptly in conditions like appendicitis, peritonitis, or ectopic pregnancy, it signals a rupture that leads to impending septic shock and potential death. This highlights the key principle that sudden changes, whether a sudden worsening or a sudden unexpected improvement, represent a priority for immediate assessment. Unlike expected findings for chronic, stable conditions, these too-good-to-be-true changes are red flags that indicate significant clinical deterioration.
Question 7. A nurse is caring for 4 clients. Which clients should be assessed first? A. A client with chronic atrial fibrillation who has an irregular pulse of 88 beats per minute. B. A client receiving a blood transfusion who reports lower back pain and chills. C. A client with pneumonia who has an oxygen saturation of 94% on 2-liter oxygen via nasal cannula. D. A client post-craniotomy who is drowsy but arouses to verbal stimuli. The correct answer is B. A client receiving a blood transfusion who reports lower back pain and chills. Rationale. Lower back pain and chills during a blood transfusion indicate a possible acute hemolytic transfusion reaction, the most serious type of transfusion reaction caused by ABO incompatibility. This can rapidly progress to acute renal failure, disseminated intravascular coagulation, DIC, shock, and death. Immediate actions required. Stop the transfusion, maintain IV access with normal saline, notify the provider and blood bank, monitor vital signs and urine output. Hemoglobinuria causes dark red, brown urine. Save the blood bag and tubing for analysis. This is a life-threatening emergency. Option A shows expected findings for chronic atrial fibrillation. Irregular pulse is characteristic and the rate of 88 is controlled or acceptable. Option C shows acceptable oxygen saturation. Greater than 90% is generally acceptable for pneumonia patients on supplemental oxygen. Option D shows expected post-craniotomy findings in early recovery. Some drowsiness is normal as long as the patient is arousable and responsive. Clinique RN test day tip. A patient receiving a blood transfusion who reports lower back pain and chills must be assessed first because these symptoms indicate a potential acute hemolytic transfusion reaction, which is a life-threatening emergency. This reaction, caused by ABO incompatibility, can lead to acute renal failure, shock, and death, requiring the nurse to immediately stop the transfusion and maintain IV access with normal saline. While an irregular pulse is expected in chronic atrial fibrillation and mild drowsiness is common after a craniotomy, the sudden onset of back pain during a transfusion is a definitive red flag for the deadliest type of reaction, requiring priority intervention and the preservation of the blood bag for investigation. Question 8. The nurse has received a report on 4 clients. Which situation requires immediate intervention? A. A client with heart failure has gained 3 pounds in 2 days and reports increased ankle swelling. B. A client receiving heparin infusion has an APTT of 92 seconds, control 30 seconds. C. A client with chronic kidney disease has a potassium level of 5.2 milliequivalents per liter. D. A client taking warfarin has an INR of 4.5. The correct answer is B. A client receiving heparin infusion has an APTT of 92 seconds, control 30 seconds. Rationale. An APTT of 92 seconds is dangerously elevated. Therapeutic range for heparin is typically 1.5 to 2 times the control, which would be 45 to 60 seconds for a control of 30 seconds.
An APTT of 92 seconds indicates the patient is at high risk for spontaneous bleeding, including life-threatening hemorrhage, intracranial, GI, retroperitoneal. This requires immediate action. Stop the heparin infusion, notify the provider, assess for signs of bleeding, and prepare for possible protamine sulfate administration, the heparin reversal agent. Option A shows fluid retention in heart failure, concerning and requires intervention, diuretics, daily weights, sodium restriction, but not immediately life-threatening. Option C shows mild hyperkalemia, normal 3.5 to 5.0 milliequivalents per liter, slightly elevated but not a critical level requiring emergency treatment. Option D shows elevated INR, therapeutic range 2 to 3 for most conditions. Elevated and increases bleeding risk, requires holding warfarin and monitoring, but not as immediately dangerous as the critically elevated APTT of 92.
Clinique RN test day tip. The Nclex frequently prioritizes anticoagulant monitoring, requiring you to remember that APTT is used for heparin, while PTINR is used for warfarin. Therapeutic ranges generally fall between 1.5 to 2 times the control value for APTT, while a target INR of 2 to 3 or 2.5 to 3.5 for patients with mechanical heart valves is standard. When comparing lab results, an APTT of 92 is considered a critical value because it is triple the control, making it more immediately dangerous than an elevated INR of 4.5. To ensure patient safety, you must always calculate the therapeutic range based on the provided control value and recognize that longer clotting times represent a significant bleeding risk, necessitating the use of reversal agents like protamine sulfate for heparin or vitamin K for warfarin. Question 9. A nurse is planning care for 4 clients. Which task can be safely delegated to unlicensed assistive personnel, UAP? A. Ambulating a client who is 1 day post-op total knee replacement for the first time. B. Obtaining vital signs on a client who is 2 hours post-cardiac catheterization. C. Collecting a clean catch urine specimen from a client with a urinary tract infection. D. Feeding a client who had a stroke yesterday and has new dysphagia. The correct answer is C. Collecting a clean catch urine specimen from a client with a urinary tract infection. Rationale. Collecting a clean catch urine specimen is a basic task within the UAP scope of practice that doesn't require nursing judgment or assessment. UAP can be taught the proper technique for specimen collection. Option A is inappropriate delegation. First-time ambulation postoperatively requires RN assessment of the client's ability to ambulate safely, monitoring for orthostatic hypotension, assessment of the surgical site, pain level, and risk for falls. Option B is inappropriate. Clients are unstable immediately post-cardiac catheterization due to risk of bleeding at the insertion site, arrhythmias, and contrast reactions. Vital signs must be assessed by an RN who can recognize complications. Option D is dangerous delegation. A client with new dysphagia, swallowing difficulty, is at high risk for aspiration. Feeding requires RN LPN assessment of swallowing ability and aspiration risk, not UAP. Delegation principle. UAP can do tasks that don't require assessment, teaching, or nursing judgment. Clinique RN test day tip. To delegate effectively, you must adhere to the 5 rights of delegation: right task, right circumstance, right person, right direction/communication, and right supervision. Unlicensed assistive personnel, UAP, are generally assigned routine, repetitive tasks for stable clients such as collecting intake and output, performing hygiene, or assisting with established ambulation. However, an RN cannot delegate any task that involves clinical judgment, such as an initial assessment, patient teaching, medication administration, or the care of unstable patients.
Crucial red flags for complexity include first-time activities, new symptoms like dysphagia, or the early postoperative period, all of which require the professional assessment and intervention of a registered nurse.
Question 10. A nurse receives a change of shift report on 4 clients. Which client should the nurse assess first? A. A client with asthma who has a respiratory rate of 28 breaths per minute and wheezing in all lung fields. B. A client with diabetes insipidus who has a urine output of 800 milliliters in the last 2 hours. C. A client with syndrome of inappropriate antidiuretic hormone, SIADH, who has a serum sodium of 118 milliequivalents per liter and reports a severe headache. D. A client with hyperparathyroidism who reports constipation and muscle weakness. The correct answer is C. A client with syndrome of inappropriate antidiuretic hormone, SIADH, who has a serum sodium of 118 milliequivalents per liter and reports a severe headache. Rationale. A serum sodium of 118 milliequivalents per liter, normal 135 to 145 milliequivalents per liter, represents severe hyponatremia, and the severe headache indicates the client may be developing cerebral edema from fluid shifting into brain cells. This can rapidly progress to seizures, coma, and death. SIADH causes water retention and dilutional hyponatremia due to excessive ADH secretion. Immediate intervention needed, seizure precautions, hypertonic saline, 3% NaCl administration, strict fluid restriction, and neurochecks. This is immediately life-threatening. Option A shows concerning asthma symptoms requiring treatment, bronchodilators and steroids, but it is not immediately life-threatening if the patient is maintaining the airway. Option B describes expected findings for diabetes insipidus. Large urine output is characteristic, lacks ADH so kidneys can't concentrate urine. Option D shows expected findings for hyperparathyroidism. High calcium causes constipation and muscle weakness, a chronic issue requiring treatment but not emergent. Clinic RN Test Day Tip. The combination of electrolyte imbalances and neurological symptoms represents a critical emergency, specifically where severe hyponatremia below 120 milliequivalents per liter, coupled with a headache or confusion, signals an imminent seizure risk due to brain swelling. Clinical priority is determined by the synergy of abnormal lab values and physical symptoms, with sodium levels below 120 or above 160 and potassium levels below 2.5 or above 6.5 considered critical. Understanding the relationship between antidiuretic hormone, ADH, and sodium is essential, as SIADH involves excessive ADH leading to water retention and dangerously low sodium, whereas diabetes insipidus involves insufficient ADH, resulting in massive diuresis and high sodium. Consequently, SIADH is managed with fluid restriction and hypertonic saline, while diabetes insipidus requires aggressive fluid replacement and synthetic ADH, such as desmopressin.
Question 11. The RN is working with an LPN and a UAP on a medical unit. Which task is appropriate for the RN to delegate to the LPN? A. Developing a care plan for a newly admitted client with heart failure. B. Administering oral medications to a client with stable chronic conditions. C. Performing initial admission assessment on a client transferred from the ICU. Or D. Teaching a diabetic client how to self-administer insulin injections. Correct answer is B. Administering oral medications to a client with stable chronic conditions. Rationale. LPNs can administer oral medications to stable clients under RN supervision. This is within their scope of practice in most states. Option A requires RN-level critical thinking and comprehensive assessment. Care plan development requires analysis, nursing diagnosis, and individualized planning, nursing process, which is beyond the LPN scope. Option C requires comprehensive RN assessment skills. Initial assessments must be performed by an RN to establish a baseline and identify all client needs. Option D involves teaching, which requires RN-level education skills, evaluation of learning, and the ability to answer complex questions about diabetes management. Scope of practice: RNs do assessment, teaching, care planning, unstable clients, IV push medications, and blood products. LPNs do data collection, not assessment, reinforcing teaching, not initial teaching, medications, PO, IM, sub-Q, sometimes IV medications per facility policy, wound care, and catheterization. UAP does ADLs, vital signs on stable clients, and basic care. Clinique RN Test Day Tip. To master delegation between an LPN and UAP, you must understand their specific scopes of practice. While an LPN can perform practical tasks like administering oral medications, performing wound care, and reinforcing previously provided teaching, they cannot conduct initial assessments, develop care plans, or manage unstable patients. Using the ADPI nursing process, assessment, diagnosis, planning, implementation, and evaluation, it is understood that the RN is responsible for every step, whereas the LPN assists primarily with implementation and data collection. Recognizing key terms is essential for pattern recognition, as initial, teaching, or unstable signify RN-only responsibilities, while stable, routine, and reinforce indicate tasks that can be safely delegated to an LPN.
Question number 12. A home health nurse is planning visits for the day. Which client should the nurse visit first? A. A client with diabetes who reports blood glucose readings between 180 and 220 milligrams per deciliter for the past 3 days. B. A client with chronic obstructive pulmonary disease, COPD, reporting increased shortness of breath and greenish sputum. C. A client with a stage 3 pressure ulcer requiring a dressing change. D. A client taking levothyroxine who reports insomnia and a 5-pound weight loss in 2 weeks. The correct answer is B. A client with chronic obstructive pulmonary disease is reporting increased shortness of breath and greenish sputum. Rationale: increased shortness of breath and greenish sputum in a COPD client indicates a likely respiratory infection or exacerbation, which can rapidly lead to respiratory failure in COPD patients who have limited respiratory reserve. This requires immediate assessment, possible antibiotic therapy, bronchodilators, and potentially hospital admission if severely compromised. This is the most unstable, time-sensitive situation. Option A shows poor glucose control requiring intervention and medication adjustment, but is not immediately life-threatening, chronic hyperglycemia. Option C requires skilled wound care but is not time-sensitive, can be scheduled later in the day. Option D suggests possible hyperthyroidism or excessive levothyroxine dosing, requires assessment and lab work, TSH, but is not immediately dangerous. Priority: respiratory compromise greater than chronic issues greater than routine care. Clinique RN Test Day Tip. Prioritizing home health visits requires you to identify the patient who is most unstable or likely to deteriorate, applying a triage framework that favors respiratory and cardiac status over chronic management. A patient with COPD who reports a change in sputum color to green or yellow represents a high priority, as this signifies a bacterial infection that can rapidly deplete their minimal respiratory reserve and lead to failure. While hyperthyroid symptoms from levothyroxine, such as insomnia and weight loss, indicate a need for a dose reduction, these issues develop over weeks and are not as immediately life-threatening as an acute respiratory infection. You must recognize that any change in baseline, such as greenish sputum versus normal mucus, constitutes a change in clinical condition that demands an immediate priority assessment.
Question 13. A nurse is preparing to delegate tasks to UAP. Which assignment is inappropriate and requires intervention by the charge nurse? A. Taking vital signs on a client with hypertension who is receiving IV antihypertensives. B. assisting a client with Parkinson's disease with morning hygiene and bathing. C. Measuring intake and output for a client with heart failure. D. Ambulating a client with stable chronic back pain in the hallway. The correct answer is A. Taking vital signs on a client with hypertension who is receiving IV antihypertensives. Rationale. This is inappropriate delegation. A client receiving IV antihypertensive medications is potentially unstable, with risk for rapid blood pressure changes, hypotension, and complications. Vital signs must be assessed by the RN, who can interpret findings, recognize dangerous trends, and titrate medications accordingly. This requires nursing judgment that is beyond UAP. Option B is appropriate. UAP can assist with ADLs, bathing, hygiene for stable clients. Option C is appropriate. UAP can measure and record I&O under RN supervision. Option D is appropriate. UAP can ambulate stable clients with chronic conditions, not acute or first-time ambulation. Key principle. UAP cannot care for unstable clients or those requiring frequent assessment and nursing judgment. Clinique RN Test Day Tip. Identifying inappropriate delegation requires you to recognize that tasks involving clinical judgment, such as administering IV medications or monitoring unstable patients, must remain with the RN to ensure safety. Red flags that indicate a task cannot be delegated to unlicensed assistive personnel, UAP, include patients receiving vasoactive drips, those in the early post-operative period, or those with a new diagnosis at high risk for complications. While a UAP can perform mechanical tasks like measuring blood pressure, the RN remains responsible for the critical nursing judgment required to interpret those values and decide whether to hold medications or notify a provider. Therefore, any task involving a patient who could change rapidly is inappropriate for delegation and must be managed by the RN.
Question 14. A nurse is caring for 4 clients. Which client requires immediate intervention? A. A client with chronic renal failure who has a serum creatinine of 4.2 milligrams per deciliter. B. A client receiving chemotherapy who has a white blood cell count of 2,000 millimeters cubed and reports a sore throat. C. A client with cirrhosis who has an ammonia level of 60 micrograms per deciliter and is slightly confused. D. A client with heart failure who has B-type natriuretic peptide, BNP, level of 580 picograms per milliliter. The correct answer is B. A client receiving chemotherapy who has a white blood cell count of 2,000 millimeters cubed and reports a sore throat. Rationale. A WBC count of 2,000 millimeters cubed, normal 4,500 to 11,000 millimeters cubed, indicates severe neutropenia from chemotherapy, and a sore throat suggests possible infection, potentially life-threatening in a neutropenic patient. This combination can rapidly progress to neutropenic sepsis, which has high mortality. Immediate actions. Implement neutropenic precautions, obtain cultures, blood, throat, start broad-spectrum IV antibiotics within 1 hour, time critical, monitor vital signs closely. This is a medical emergency. Option A shows elevated creatinine expected in chronic renal failure, chronic issue requiring management but not immediately life-threatening. Option C shows elevated ammonia, normal 15 to 45 micrograms per deciliter, causing hepatic encephalopathy, requires treatment, lactulose or rifaximin, but not as immediately life-threatening as sepsis. Option D shows elevated BNP, indicating heart failure, requires treatment, but is expected finding in HF patients. Clinique RN Test Day Tip. The combination of neutropenia and any sign of infection constitutes an immediate medical emergency due to the high risk of sepsis, requiring the administration of antibiotics within 1 hour.
Because neutrophils serve as the primary defense against bacteria, a patient with a severe absolute neutrophil count below 500 cannot fight infection, making even a sore throat or a low-grade fever potentially deadly. In Nclex prioritization, acute infection in an immunocompromised patient takes precedence over chronic conditions like hepatic encephalopathy, as sepsis can be fatal within hours. Effective chemotherapy teaching must emphasize strict infection prevention measures, such as avoiding fresh flowers, raw foods, and crowds, while stressing the vital importance of reporting a fever above 100.4 degrees Fahrenheit immediately.
Question 15. A charge nurse is assigning clients to staff. Which assignment is most appropriate for a float nurse from the postpartum unit to the medical surgical floor? A. A client with diabetic ketoacidosis requiring continuous IV insulin infusion. B. A client newly admitted with pneumonia requiring IV antibiotics and oxygen therapy. C. A client with stable heart failure admitted for diuretic therapy and daily weights. D. A client post-abdominal surgery requiring pain management and wound assessment. The correct answer is C. A client with stable heart failure was admitted for diuretic therapy and daily weights. Rationale: a stable client with heart failure requiring routine care, diuretics, daily weights, vital signs, is the most appropriate assignment for a float nurse from another unit. This client is predictable and requires fundamental nursing skills that any RN should possess. Option A is inappropriate. DKA with continuous insulin infusion requires critical care skills, complex titration, frequent monitoring, and specialized knowledge of acid-base balance. Option B involves a new admission requiring assessment, coordination of care, and respiratory management, requires medical surgical expertise. Option D requires post-operative assessment skills, including wound evaluation, pain management, and recognition of surgical complications, requires med-surg experience. Floating principle: assign stable, predictable clients with skills transferable across units. Avoid complex, unstable, or specialty-specific situations.
Clinique RN Test Day Tip: determining float nurse assignments depends on identifying patients who are stable and require routine care, focusing on universal nursing skills like medication administration, vital sign monitoring, and basic assessments. A postpartum nurse, for instance, is competent to manage a stable heart failure patient on diuretics because the fundamental skills of monitoring intake, output, and vitals are transferable across specialties. Conversely, float nurses should not be assigned new admissions, patients on critical titration drips, or those requiring specialty procedures like chest tube management. While a nurse cannot refuse to float, they have a legal obligation to refuse specific assignments that fall outside their competency, ensuring that the charge nurse assigns patients based on a stable and fundamental rather than a complex and specialty framework.
Question 16. The nurse has received the morning laboratory results for 4 clients. Which result requires the nurse to intervene first? A. A client taking furosemide who has a potassium level of 3.3 milliequivalents per liter. B. A client with dehydration who has a sodium level of 149 milliequivalents per liter. C. A client receiving IV heparin who has a platelet count of 48,000 per cubic millimeter. D. A client with chronic kidney disease who has a calcium level of 8.2 milligrams per deciliter. The correct answer is C. A client receiving IV heparin who has a platelet count of 48,000 per cubic millimeter. Rationale:
A platelet count of 48,000 per cubic millimeter in a client receiving heparin suggests heparin-induced thrombocytopenia, or HIT, a serious immune-mediated reaction causing both thrombocytopenia and paradoxical thrombosis, blood clots despite low platelets. This is immediately life-threatening. Immediate action required. Stop all heparin immediately, including heparin flushes. Notify provider. Obtain HIT antibody testing. Switch to alternative anticoagulant, argatroban, bivaluridin. Monitor for thrombosis. This is immediately life-threatening. Option A shows hypokalemia requiring potassium supplementation, but not immediately dangerous at 3.3. Option B shows mild hypernatremia expected with dehydration, requires fluids but not critical. Option D shows low normal calcium common in CKD, requires monitoring but not emergent. Clinique RN test day tip. The occurrence of low platelets while a patient is on heparin signifies heparin-induced thrombocytopenia, a paradoxical medical emergency where a low platelet count actually leads to a high risk of thrombosis. HIT typically develops 5 to 10 days after heparin initiation and is characterized by a platelet drop of more than 50% from the patient's baseline. The most critical nursing action is to stop all forms of heparin immediately, including heparin-based line flushes, and switch the patient to a direct thrombin inhibitor, such as argatroban. Unlike standard heparin overdoses, you must never administer protamine sulfate or platelet transfusions for HIT, as these interventions can worsen the clotting process and lead to immediate stroke, myocardial infarction, or death. Question 17. A nurse receives report on 4 clients at the beginning of the shift. Which client should the nurse assess first? A. A client with pneumonia who has an oxygen saturation of 91% on room air and is requesting a breathing treatment. B. A client with a leg cast who reports numbness and tingling in the toes with inability to move them. C. A client with ulcerative colitis having 6 to 8 loose stools daily who requests a PRN antidiarrheal medication. D. A client with a urinary tract infection who has cloudy, foul-smelling urine and reports burning with urination. The correct answer is B. A client with a leg cast who reports numbness and tingling in the toes with inability to move them. Rationale: numbness, tingling, and inability to move toes in a casted extremity indicates compartment syndrome, a surgical emergency, where increased pressure within the muscle compartment compromises circulation and nerve function. Without immediate intervention, cast removal, possible fasciotomy, this leads to permanent nerve damage, muscle necrosis, and potential limb loss within 4 to 6 hours. The 6 P's of compartment syndrome are pain, disproportionate and unrelieved by pain meds; pressure; pallor; pulselessness, a late sign; paresthesias, numbness or tingling; paralysis, inability to move, late sign, emergency. Immediate action: remove the cast, elevate the limb to heart level, not above, decreases arterial flow. Notify provider for possible emergency surgery. Option A shows expected findings for pneumonia with acceptable oxygen saturation, greater than 90%. Option C describes expected symptoms of ulcerative colitis. Option D shows expected UTI symptoms. Clinique RN test day tip. The inability to move a casted limb indicates compartment syndrome, a surgical emergency where increased pressure within a muscle compartment restricts blood flow. You must memorize the 6 P's of neurovascular assessment, recognizing that paresthesias and paralysis are late indicators of tissue ischemia, while pain out of proportion to the injury is the earliest red flag. Unlike standard swelling, a limb with suspected compartment syndrome should be elevated only to heart level, not higher, as excessive elevation further decreases arterial perfusion. The immediate priority is to alleviate the pressure by bivalving or removing the cast, as delayed intervention in the presence of numbness or tingling leads to permanent tissue death. Question 18. The nurse is planning assignments for the nursing team consisting of one RN, one LPN, and one UAP. Which task is appropriate to assign to the UAP? A. Reinforcing teaching for a newly diagnosed client with diabetes about foot care. B. Obtaining a fingerstick blood glucose test on a client with diabetes before breakfast. C. Administering NPH insulin subcutaneously to a client with type 1 diabetes. D. Assessing a client's peripheral pulses after a cardiac catheterization. The correct answer is B. Obtaining a fingerstick blood glucose test on a client with diabetes before breakfast. Rationale. Obtaining a fingerstick blood glucose is a basic task that UAP can perform after proper training. This is a standardized procedure that doesn't require nursing judgment, though the RN must interpret the result and make decisions about insulin administration. Option A involves teaching. Even reinforcing teaching requires assessment of understanding and ability to answer questions, which is within LPN scope, not UAP. Option C is medication administration. UAP cannot give medications. This is LPN-RN scope. Option D requires assessment skills to detect complications, bleeding, hematoma, absent pulses indicating arterial occlusion. This is RN scope only. Delegation principle. UAP can collect data, blood glucose, vital signs, INO, but cannot interpret or act on it. RN must evaluate results and make clinical decisions. Clinique RN test day tip. To delegate safely, you must distinguish between data collection, which involves the objective recording of measurements, and assessment, which requires the interpretation and analysis of that data. While unlicensed assistive personnel can perform mechanical tasks such as measuring fingerstick glucose levels, the responsibility for deciding an insulin dose based on those results rests solely on the RN or LPN. A useful rule for determining UAP scope is whether a task is routine and repetitive enough to be taught quickly without requiring nursing judgment. However, any activity involving teaching or the reinforcement of education remains within the scope of licensed staff. Ultimately, while a UAP can remind a patient of a safety task, the RN and LPN are responsible for the clinical judgment, medication administration, and the evaluation of patient learning. Question 19. A nurse is triaging clients in the emergency department. Which client should be classified as emergent and seen immediately? A. A 35-year-old with a suspected fracture of the wrist following a fall with pain 7 out of 10. B. A 50-year-old with chest pain radiating to the jaw, diaphoresis, and nausea. C. A 22-year-old with a laceration to the hand requiring sutures, bleeding controlled with pressure. D. A 68-year-old with a fever of 101.5 degrees Fahrenheit or 38.6 degrees Celsius and urinary frequency for 2 days. The correct answer is B. A 50-year-old with chest pain radiating to the jaw, diaphoresis, and nausea. Rationale. Chest pain radiating to the jaw with diaphoresis and nausea represents classic acute myocardial infarction presentation, immediately life-threatening and requiring emergent intervention. Immediate priorities: oxygen, cardiac monitor, IV access, ECG within 10 minutes, aspirin, nitroglycerin, morphine if indicated, troponin levels, and preparation for possible cardiac catheterization. Time means muscle. Every minute delays treatment and increases myocardial damage. This is emergent, life-threatening, requiring immediate treatment. Option A is urgent, needs treatment within 1 to 2 hours, but not life-threatening. Option C is urgent, bleeding controlled, stable, can wait for suturing. Option D is urgent, likely UTI requiring antibiotics, but not immediately life-threatening. ESI triage levels. Level 1 means emergent, immediate life threat. Level 2 indicates urgent, high risk. Level 3, urgent, moderate complexity. Level 4-5 mean less urgent/non-urgent. Clinique RN Test Day Tip. To effectively triage, you must identify emergent categories such as airway or breathing obstruction, cardiac chest pain, severe trauma, uncontrolled bleeding, and altered mental status. A classic myocardial infarction, MI, presents as chest pain radiating to the jaw, arm, or back, often accompanied by diaphoresis and nausea. However, nurses must also recognize that jaw pain alone can be a key indicator of cardiac ischemia due to shared nerve pathways. Because time is muscle, the clinical standard requires a door-to-ECG time of less than 10 minutes and a door-to-balloon time of less than 90 minutes for a STEMI. While urgent cases require treatment within a few hours, emergent cases follow the mnemonic can't wait, won't wait, might die, necessitating immediate action to prevent imminent death. Question 20. A nurse has delegated several tasks to a UAP. Which action by the UAP requires the nurse to intervene? A. The UAP reports a client's blood pressure of 178/96 millimeters of mercury but continues with assigned tasks. B. The UAP assists a client with chronic arthritis to ambulate in the hallway with a walker. C. The UAP records the intake and output for a client receiving diuretic therapy. D. The UAP provides oral care to a client who is NPO before surgery. The correct answer is A. The UAP reports a client's blood pressure of 178/96 millimeters of mercury but continues with assigned tasks. Rationale. This requires immediate intervention. While UAP can measure and report vital signs, when critical values are obtained, such as significantly elevated blood pressure, 178/96, the UAP must immediately report to the RN for assessment and intervention, not continue with other tasks. This blood pressure requires RN evaluation. The client may be having a hypertensive crisis, may need PRN antihypertensive medication, or may be experiencing symptoms requiring assessment. The UAP's failure to recognize the urgency and report immediately is unsafe practice, requiring correction. Option B is appropriate. UAP can assist stable clients with chronic conditions to ambulate with assistive devices. Option C is appropriate. Measuring and recording I&O is within UAP scope. Option D is appropriate. Oral care for NPO clients is basic care within UAP scope. Supervision principle. RN must ensure UAP understand when to report abnormal findings immediately rather than waiting until end of shift or completing other tasks first.
Clinique RN Test Day Tip. Effective supervision in delegation depends on the UAP's ability to immediately report abnormal findings rather than simply recording them in the chart. When delegating tasks such as vital sign measurement, the RN must provide clear, specific parameters, such as notifying the nurse if a blood pressure exceeds 160/100 or falls below 90/60, to ensure that critical changes are addressed without delay. An Nclex pattern often asks you to identify actions that require intervention. In these scenarios, a delay in reporting a critical value is a significant safety breach. The guiding principle for assistive personnel should always be to report any concerning data immediately, as the RN holds the ultimate responsibility for interpreting that data and determining the necessary clinical response.
If this video helped sharpen your priority and delegation skills, don't stop here. Head over to cliniquern.com and sign up for free to access more high-yield Nclex practice, deep rationales, and exam-ready strategies. Thanks for watching, and I'll see you in the next one.